I'm Dr. Sandra Evans. I'm a consultant in old age psychiatry at City in Hackney and an Associate Dean in Psychiatry at Barts in the London School of Medicine and Dentistry. I'm going to talk to you today about depression and anxiety disorders in older people. The learning objectives for today are to revisit symptoms of depression and anxiety in older people. You'll have known already about depression and anxiety symptoms in younger people, and it's very similar to older people, but there will be some additional complexities in older people because of age and because of physical comorbidities. I want to consider the etiology of mild to moderate mood disorders in older people, and the reason is that they're not all, again, simple reasons that people get unwell, and the reasons that people become unwell are also useful in helping us to think about the psychosocial adaptations and influences that can actually make people get better. I want to talk about the context of assessment when there are physical symptoms, physical illnesses in later life, and also the life events of older people. And I'm going to talk about treatments, including drug treatments and psychological treatments. It's useful in this day and age when most of psychiatry and psychiatric patients are treated in primary care to think about when referral to community mental health teams is appropriate. And I'm going to talk a little bit about recovery because that is also fundamental. The themes that I'm going to be talking about today include talking about ageing generally, and I want to talk about ageing in the context of the personality. And in psychiatry, as you know, we're very keen on thinking about pre-morbid personality. And in old age psychiatry, it's just as important to think about how the personality of the person who becomes ill might affect either the way they present or their ability to recover from their illness. I'm going to be talking about depression and anxiety, but also depression and anxiety together because they're often found together in older people. I'm going to talk a little bit about dependency because dependency is a theme in ageing, and it is the case that as older people become more frail, they may depend on their families or on their communities more. And there may be some anxiety associated with the dependency of late life in the clinicians dealing with them. But actually, dependency is very normal, and we shouldn't shy away from it. The other thing to highlight really is that early signs of dementia may also be linked with anxiety symptoms. And so if you're seeing anxiety symptoms and sometimes depression, which is refractory to treatment, you need to consider whether early dementia is part of the clinical picture.